Well, today's video is just on how I personally take my report sheet and what I do with it. I know everybody has their own styles about like getting organized, having everything all labeled, or like making copies of their own little way, technique, and they don't like to use anything else except what they have. And there's a lot of things on the internet where you can always like print out and download and go from there and have your little spaces where you can write your drips and all that stuff. I personally don't like those, but it's how people roll and how they do their things. But with me and our place, they usually print out like this thing that has like the patient name, like A, B, and it'll have say full code, their MR, unit number, date of birth, and they'll say like their diagnosis here, and then their history, and then family number, da da da, and then other known allergies, and then here in like ICU how we do it, we'll write like a history of what happens with the patient. So like today, like CPAP today, or they came from the ambulance, da 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 da, heart attack, chest pain, CPR, attained ROS, this much epi given, and then going on like surgery this day, and then they're planning on transferring this day, just so everybody's aware of what's happening. So when you give a report, you do your little thing and then give them a story of what's happening instead of going all the way back into the notes and looking for that, because no one really has time for that unless you like really have time to look for it. That's why communications is a key part in nursing, updating things and going from there and not losing communication throughout shift report. And that's why they say shift report is the most important part. Because why? Because information is all there and should be all there, because no one's going to sit here and read every history and not take care of their patient and do their other part of the job. But in the end, that's all we have. I don't know, each hospital could be different. They don't print stuff out like this. It depends. But if it's not, then you're on your own on that one. But this is how I do it. I get the paper and then I fold it in half, and then I'll just go like this. They'll like give me a report, like usually hopefully it's like a head to toe assessment, and I'll do like neuro, like GCS, okay, 6 is following commands, follows commands, and then like Perla check, okay, they'll say like 3 bilaterally, whatever it is, and then like neuros are Q4, okay. And then not much else I need from there. If like we have a RAS score, I can put a RAS -1, like the goal or whatever, depending on the patient. If they have ICPs, I can write ICPs here, goal, where's the level setting at, what's it been running at. But it just depends. Then we go down to cardio, and they'll say like normal sinus rhythm the patient's been in, maps goal is greater than 65. And then they'll say pulses +2, and then edema or whatever you need to say. Not much else there. And then if there's Tmax, you can put Tmax up here like 37.9. Respiratory, we can go depending where you need her on this stuff, but we're just going with the ICU here. They'll say ET tube. They'll say 7.5, 23 at the lip. And then they'll say vent settings, AC. Then we'll say 400 tidal, and then 40%. People 5, rate of 14, and then secretions, da 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 da. And we'll go to GI, we'll go OG2, we'll say longevity 1.5, maybe like 40, goal of 60, and then free flush water at like 100 Q4, and then no BM, all right here, and then what else you need to write from there, residuals or anything like that. I'll go to GU with like a Foley, and then they'll be telling me 40, 30 or 40 they put out every hour. They have a condom cath or whatever it is, incontinent, whatever the situation is. Now we'll go down to skin. We'll say like bruises, generalized, and then coccyx, redness. So whatever they have, I'll just write it there. IV will go down, maybe they'll say write IJ. And this is where I write all of my drips down. So I just have everything categorized and not mixing it up all over the place, where I have like Levo here, Dex here. So I just have everything in just one little area. So like I'll say Levo at like 10 and Neo at like 100, and then Dex at 0.2, Fent at 50. But just whatever random numbers. But that's all I have from here. I like to have a color coordinated pen usually, and I'll have like a black pen like this. Color coordinated because like if they tell me, oh, I didn't get to do this, or can you follow up with this, I like to make little side notes here with the color pen, so you just switch on and off. And it's easier to follow track, so throughout your day you know what's going on. But then I'll make like little boxes here that make it easier for me to know what I need to do. If they tell me, oh, replace potassium later and replace K plus times 1, then I can just have it here, and then my shift I can know, I can check it. And then here, like, ask MD change med of BP from this to this, da da da, or like change parameters. Change parameters. This is how I write. I really don't care, but I'm the only one that's reading it, so it doesn't really matter, right? But that's all I do from there, and pretty much I carry this all day and put it in my side pocket and walk around with it. If I need information, I'll look at here. If I don't have answers, I can always open up the computer charting, and it's 2018, everything's electronic, so it's whatever. But the other thing is, from here, you can write here, and then like you can write your own assessment here, or you can do your Q4, whatever your situation is, and write another one here. But this is all I carry, and then I print out labs and carry that with me too. So honestly, everybody has their own style, their own technique, but this is how I do it. Just giving you a little glimpse of how I take notes or shift report, and I've been fine doing it like this. Haven't had really any issues. Sometimes I might be missing information, but like I said, everything's on the computer, so honestly, there's one way or another you'll get the answer. If not, you'll work it out together. It's all about communication, but this is just your little sheet on to get you going throughout your shift, throughout your day, and giving you a report for the next shift. So there you have it. That's all it takes, is just a little shift report, a guideline on how I do it from head to toe with the IVs. And comment, like, subscribe, give me your advice, what you guys like, help each other out, and go from there. Peace.